Good morning, everyone, and welcome to the Jackson County Board of Supervisors meeting for Tuesday, January 23rd of 2024. Welcome, everyone. We hope you're staying warm and safe this morning, and if what the advisory from the DOT and our engineer and road workers are to stay home. Like it, right? Or stay off the roads or be careful anyway. So anyway,
Toe ban.
there is a tow ban on, so yeah, so if understand if you go in the ditch, you're probably not gonna get somebody to tow you out, so. First on our agenda this morning is Mr. Todd Kinney, our Jackson County engineer. Good morning.
Morning. So first off is the kind of a review and update of the dust control policy. Reviewed this with the office manager, the new room foreman and assistant. And kind of the main switch from here is, one, we're not requiring a fee anymore. Two, we're not providing the flags. The flags still have to be there. But I guess the issue we're trying to resolve is that people would have to come in here to get the permit, pay the $5 and get the flags. And if they didn't do that, sometimes they would call up the applicator and say, hey, I want dust control. And they'll say, oh, they put it on the list. And then the applicator sends us the list to get the roads ready. And we don't have a permit for this person that called the applicator directly. So what this change allows, really the applicator can fill out the permit for the person if they want, because there's no fee. The applicator, the commercial applicators don't have to pay the fee. All that stuff. They don't have to come in and physically get the flags and get their old flags at Tyson's or wherever. So it just makes it easier, I think, for the person to get the permit. They don't have to physically come into the office and get a permit.
So obviously, these are online that the applicator can do these and email them in and.
That's correct.
Yes. So I guess, yeah, if he was charged a fee, I suppose he could pass that along, but I don't suppose that amounted to $100.
What for the applicator to process the permit?
$5. That what the permit was, $5?
Only
$5. And but we had to basically that gave them the sign, so it was not like we were actually
Right.
We weren't making anything.
any revenue on that. So, and it sets up the schedule I think it streamlines it. So the permits have to be submitted by April 15th. We get the list from the applicator by May 1st. We have till May 10th to get everything prepped. And they come in and they can start their applications after that on May 20th.
Are them dates all the same as they previously were?
No, so those are changed. So like before it was, if you wanted to put it in on a Monday, you had to call us by 10 a.m. the following Monday. And it was it was a week's notice, but it could have been how do I say, kind of unorganized. Like it could have had 10 permits on a Monday come in and 15 on a Tuesday or whatever. But now it's just the residents have to get the permits in by April 15th. The applicator sends us a list by May 1st. And then we get the road ready, and then the applications, they can start on May 10th.
Okay,
So it's everything is structured now.
So why I asked was, what was the previous submittal date for a deadline? Did that change? Because that will confuse, if they did usually have till April 30th.
I think we really had a date, did we?
So
You just had to give a 7-day notice.
it's supposed to start on May 1st. So you had to give a week's notice. So,
It was the 21st or something like that.
well, no, it was, you had to notify a week ahead of time, and you could start the applications on May 1st through September 30th. So there was, in my mind, it was like kind of unorganized.
I agree, but they previously had, it sounds like they had until May 1st or a week before May 1st to apply. Now we're moving up the application date. So, I mean, we have to make them aware of people that.
Yeah, so it's moved up to the 15th before you had till April 1st. So we'll put this in the paper and everything, obviously, but
I don't get the paper.
You could read it online, probably.
No, but that's what they say.
That's what you're
I
gonna get, is I don't get the paper.
I don't listen to KMAQ,
No, we'll probably have I would say some issues phasing this in, but this is like moving forward each year. Now this will
Yeah.
become the
Sure.
standard where before it wasn't. So it may take a time.
And it might be easy
A learning
enough
curve.
to look back, if somebody's got some time to look back, see who did apply.
We're actually getting dust control permits in now.
Yeah, I mean, some that did apply late last time around, say, hey, you gotta apply by, I don't know how much work that is, but I don't know how many there is, I have no idea how many there are. So you're looking for approval of this resolution, is that correct?
Correct.
We have a number for this resolution?
So it's resolution 1011-01-23-23-2024.
Second that.
Have a motion and a second to approve resolution 1011-01-23-2024. All
Needs
those-
more numbers in your screen there.
All those in favor say aye.
Aye.
Aye. Opposed, same sign. Motion carried.
So now this still, you're keeping all the rules, like if we need to blade through it.
That doesn't change, yeah.
Rain and.
Yep.
We have the right to do that.
Yeah, they're not supposed to change the cross slope of the road, all that stuff's still the same.
Okay.
I think people forget that sometimes.
The next one here is a resolution for bridge weight restrictions. There's really 4 new changes. That's the first part of the resolution. For the weight limits, and then the second part is to remove the weight restrictions for bridges that have been replaced here in the last couple of years. So there's basically 18 of those, which is kind of nice to see that we got 18 bridges that were posted now that will be back to full capacity, non-posted bridges, so. It's good.
I guess my question is, how did we do that? We didn't replace all them 18.
So, one was a timber deck that got replaced, so the deck itself was causing a rating. One was replaced with a pipe, and the other 16 were bridge replacements.
Oh, nice. So do we do this yearly, take them bridges off restrictions?
Well, I think this actually goes back to, there's a bridge that was from 21, must have been done late in 22, 21, and there's some in 22. So this is actually over about a little over a 2-year period, so it's not all in 1 year, so. Technically.
Just removes it.
Right,
until
so
we change it.
technically, when you do a resolution to establish a weight limit, when that bridge gets replaced, you have to do a resolution, take the posting off. So we're cleaning that up because
Of course, somebody would have to inspect it again, correct, and give it
that's correct.
a thumbs up.
So when we have a new bridge, there's what's called a Form 107 we send in. And then the initial inspection that we do, I have to put in the load ratings for the bridge, and that's the time when the load ratings get updated. But still, you guys, the posting of this bridge for the weight limit doesn't get pulled off of there until you pass a resolution to remove it. So that's what this is gonna
Right.
be.
And the 4 that are getting put on never had weight limits before, or they had previous?
They had limits before, they're not being adjusted, I think.
Okay.
I'll make that motion to approve this resolution.
Second.
I have a motion and a second to approve resolution number
1012-01-23-2024.
All those in favor say aye.
Aye.
Aye, opposed? Motion carried.
Okay, just real quick. The last pay period here, looking at payroll, so 1,083 hours of overtime worked. So it's been a busy last couple weeks. We actually have a paid overtime, so guys that took OT as pay of 15,398. The total value of the overtime work, so a lot of these guys banked it as comp time. But the total value of that all combined is just over $43,000, so pretty good chunk of overtime.
I think we want
We
to
hope
make
that don't happen every 2 weeks, huh?
Well,
We're on a good start here.
Yeah, we're on a similar start to this payroll, but the other thing too, obviously, with the weather pattern we're in and looks like we're gonna be in for a little bit, and now looking at the end of next week being in the upper 40s, low 50s. Anytime we get rain in January, February, that's that's bad for the gravel roads. Obviously, with this rain and then warmer temps, the top 1 or 2 inches starts to thaw, we're gonna have muddy driving conditions. There's just no way
I
around
don't
it.
know if it was ever really frozen this year.
Well, there'll be frost, but it'll be now that we get this warming temps and the rain, it'll start melting from the top down, and we'll get that top 1 or 2 inches will be like churned up into mud, pretty much, so.
Yeah, last week when they were cleared and we had, 15 below, it went down pretty quick, but they had a foot of snow that sure was.
Yeah, so I mean, obviously we won't be doing much of any rock hauling because it really doesn't do a lot of good.
I'm assuming there'll be a lot of public works people in all the towns in Jackson County going through trying to dig out their storm drains. Cause I noticed driving through Wacona, there's becoming lots of pooling.
Yeah,
That's good.
yeah, getting rain in January and February is just don't, it's just hard to deal with, because especially when we got this much snow and everything else, so.
Well, I would ask you to thank the crew for their time spent. I know they were out there lengthy hours in the 2 storms, sleeping and eating, if you will, in the shop. So thank them for that, and hope we can move forward, and we don't have them every couple of weeks, but
It should, hopefully it starts to taper.
yeah.
And then we got the union meeting at 10:30 right downstairs,
Yeah, well, they're not coming in, so it'll just be.
the business rep.
Yeah.
Yeah, okay, that's all I have.
All right, thanks, Todd.
Just us meeting.
Any questions?
He
for
isn't
Yeah.
coming down either.
The business rep isn't?
So we're, I think, figuring out what,
Responding to
We'll
the
have a
written
meeting.
response?
Yeah.
Okay.
All right, is there any visitors or citizens either on the Zoom or in person? I don't see any, so. Like to approach the board? Seeing or hearing none. We'll move to Jeff. We had a short conversation with Jeff this morning. He's fairly busy with clearing ice and snow, so. He will not make it in today. Our facilities manager.
But if you notice, they got our blinds and stuff, so they're getting.
they're getting
Have they
closer.
got all the windows prepped for the blind people, or are they pretty close?
Close.
So
Which
they're doing a lot of work.
I would wanna say thank you for that, because I've also had a busy week like everybody else that's clearing snow, so.
Well,
they've been
anybody,
busy.
I guess that's another thing to be said. We had some new employees come in, either on secondary roads and or local here. Got kind of thrown right to the wolf right away, so we thank them for putting up with it and having some patience with us, so anyway. Anyone else? Comments?
We should ask Todd how the Lamont district is doing with that position still being.
Other people are kinda filtering
Helping
in.
out. I think Bomber's back in one of the trucks. I heard him the other day, so. Lisa, are you available?
I am. I just need a motion to approve the minutes of the January 16th, 2024 board proceedings as written by Auditor Smith and authorized publication in the official newspapers.
So moved.
Second,
Motion second, approve the minutes from January 16th, 2020 board proceedings as written. All those in favor say aye. Aye, opposed, same sign. Motion carried.
That's all that I have for the board today.
You are awesome.
Yep.
Luann? Good morning.
Good morning.
You have a safe walk this morning, you get drove in.
No, I did just fine so far. I'll see how it is going home. Calendar for this week. Clearly the 10:30 union negotiations is just gonna be us, the supervisors and Todd in that for that. At 6 o'clock tonight is a zoning commission meeting in the community room downstairs or by Zoom. That's the last that I heard. I don't know that they tried to cancel it. Wednesday, January 24th at 9 AM is an IRIS meeting for NIN, either in Dubuque or by Zoom. And at 7 o'clock tomorrow night is a Jackson County EMS Association meeting in Delmar. And Mike and NIN usually go to those. Thursday, January 25th at 9 AM is a RPA meeting in Dubuque for Don and NIN. Friday, January 26th at 7 AM is a Macocata Leadership Team meeting by Zoom for Don. Our next regular meeting will be Tuesday, January 30th at 9 a.m. And that afternoon at 4 o'clock will be in early childhood Iowa. That would be a council meeting. I think I pulled over in there, but it's just a council meeting in DeWitt for Nan if she decides to go to that. I think that's all the business I had for you today.
So I did get an email yesterday, I think. Lisa, did you get that one too? The budget 101 session or work session, if you desire at 1:20 Thursday evening, I would think. They even had lunch at 5 or 6, and then they had a couple of.
Is that the one for February 7th? Or the one, and the one for, yes, I found a couple of them. I went to ECA's website, so I
I
will,
think there's one this Thursday.
yeah. Yes, there's one tomorrow night as well, so
That might be the one in Delaware, because they pieced them out, so that might be a little later. I have to check that.
So it came from ECIA? Who did the email come from?
I think it came from UCI. It's one of those that doesn't look like it's much. I printed out a few things. I'll bring them in here when we get done.
Okay, just so somebody's aware, I have a commitment that evening, so. I think Delaware's is first, so they might be tomorrow or Thursday night. I'll look that up. Okay, anyone else? Any questions for Luann? Thank you.
You're welcome.
Okay, well, we're moving right along. Any board or commission reports?
With the Macoka River Water Management Authority, we're in the final stages of finishing the contract between the Limestone Bluffs RC&D and WMA. We'll have to get that finalized next week. We're also finishing the contract between Aaron and the WMA, getting that worked out. We got a few grants in the works. Everything's going good for the most part. RC&D, same thing. Michelle's kind of hit the ground running and having some logistical problems getting signed on with permissions and using software, but she's got about 20 grants in the pipeline, it seems like, and that's quite a bit. We're hoping she's not biting off more she can chew, but she seems pretty proactive in wanting to do it and can handle it. Jackson County Alliance, Economic Alliance, they're getting ready. They're having I think it's in March, I think it's March 7th, they're having their annual banquet or whatever, appreciation for their people. Got a few things in the works, but otherwise it seems like everything's kind of status quo.
Last week we had the ECIA Council and Exec Board meeting, of course, and there's went through the year in financing, and there is some new positions available up there, so they're going through the process of hiring up there also for executive director yet. So that's moving along. Have a council or a board, if you will, assigned to that process. Waste Authority, been really slow in December, and they kind of attached it to the weather somewhat, and construction went really slow, been slow with the interest rates being up. I mean, the last couple of months, they said that construction had been slow, so they noticed the drop off. And so it's been a couple rough months for them up there, but they expect the spring to level back out and be fine. We had the auditors come in and go over the 6 months, if you will, end of 6 months, half year term. So we find out today whether we're gonna get a new semi truck. We have one order for, I think, over a year. There's 62 on order, and I think they have the ability to build 12. So we're hoping that we've had ours in there for a time frame. I know we talked about, we had to adjust pay for our new dump trucks last week on the secondary roads, and I suppose hopefully that doesn't come here either, but we hope we can get a truck so we can still operate, you know. Anyway, that's where we are with that, and the way the supply chain is nowadays, so. That's all I really have. Jack, we will take a short recess at this time.
We coordinated our clothes today.
I guess so.
We're not in mourning, are
We
we?
will,
I am, I'm a Packer fan.
Well, yeah.
oh, that was awesome. I was so worried. We will reconvene at this time.
Good morning.
I was almost ready to break my TV. Good
Um,
morning.
So Jack and I are here again following the Region's Governing Board meeting from yesterday afternoon, and then I apologize, I didn't look up at the screen, were you able to?
Yeah,
get
I got on, it was just
She
the,
said she couldn't hear.
I could hear, but not very
Easily,
well. I
yeah,
mean, you had to really strain to hear
yeah,
what was being said, you know.
Well, there
Like I
for a
told
while.
Jack, I said I was sitting at the kitchen and if my refrigerator kicked on, I couldn't hear it,
oh, yeah.
you know.
You know, we have that owl, but they didn't have it turned up at the beginning, and then somebody said, we're having a hard time hearing, even in the room, so they jacked it up a little bit, and that made it a lot better,
And
but
then the other thing, I don't know, so like, when you log on there, the big screen is on. And I'm sorry, I don't know their names.
Oh,
Kind
like
of the-
Lori, the
Yes.
lady who talks
Yes.
a lot, and Ken Beck, the chair.
Yeah, and then the little screen at the top is where you guys were watching the videos and that, it's like, it would have been nice if
Don't it switch when they talk though? Does
No.
it switch? No?
it
No, it
doesn't,
shouldn't.
it
I think
stays
that's
on
a
them.
setting on it though, whoever sets it up in it.
Yeah, I don't know, I can mention that to Lori, just that
Yeah,
as a virtual participant.
because if you couldn't hear, there was a lot on yesterday, so
Mhm.
they couldn't have heard either.
right, I mean, I could hear, but you had to.
Had to
Listen,
turn your hearing aid
Yeah.
up.
You gotta listen.
yeah,
So when they showed those video clips with me TVA Media,
that
were
was
they on your big?
50 miles in the back,
They were in that small, okay,
yeah, I couldn't see the videos at all.
okay.
But you should be able to follow, like your, whoever speaks, the owl should follow that speaker, I would think.
Yeah, they usually turn a little bit for the,
Yeah.
some of them I've seen do.
Yeah, so I'll mention that to Lori, so she's aware. So we did meet, first order of business was to elect new officers. Jack is gonna continue as secretary, Jim Irwin from Clinton County as vice chair, and Ken Beck from Scott County as chair. So they remain the same. Financial reports from David Farmer, Region's fiscal agent. His projection for the end of this current fiscal year would be that we would be at a 29% fund balance if we spent 80% of our budget, which historically is about where we land. If we were to spend 100% of the budget that we have currently, we'd be at about 23%. So either way, we're still pretty far away from that 5% target. And I have not heard anything at all legislatively that they're talking about revisiting that. You might remember those conversations from the past several years. But, so that's kind of where we're at.
One of the things they did discuss is, in the past, we've opened it up for one-time funding. And that's something that Lori brought up yesterday, and that's potential to try to reduce some of that over. And so we'll see what happens, but
I mean, we've talked about that before too, Jack, in the past, you know, you don't spend it just to spend it.
Right.
But you've got it and you won't get allocated anymore until you get our budget, you know, I don't know if they were talking 10% even, but that still wouldn't get you in the parameters of where.
Right. So along that line of one-time funding, while these were not awarded through a formal RFP process, but for various reasons, the board felt it was appropriate to authorize some funding. They actually authorized it last month to purchase a chair, a piece of equipment for Zero Frenchman Health Center, a second chair for them to provide a treatment called TMS, transcranial magnetic stimulation. It's a non-invasive way of treating major depression. It also can be used for people with obsessive compulsive disorder.
I thought Don was gonna get one of them. We talked about that last time.
To the tune of $74,700
and that's half,
at
and
half
that's
price.
half price.
Yeah, so $150,000 is.
Yeah.
Yeah,
Why don't you get a couple of them?
You bet.
yeah.
I didn't spend that on my bill.
Yeah. So that was one expenditure that was not planned for in the budget, but The other one is actually almost a $300,000 expenditure, and that's $297,375. And this is for a program called Classroom Clinic. It is a company based out of Carroll, Iowa, that they started just a couple of years ago, I believe. And what they are making available to our region by the board entering into a contract with them is telehealth services to several school districts within our region. They provide telehealth therapy and med management, med prescribing, all virtual. I forget now how many different school districts they are in Iowa. They are not contracted with any region like they will be with us, but between now and June 30th, this money will be spent to provide this service to up to what they call units, 15 units. A unit is pretty much equated to about 1,000 students. Originally, they said they could serve up to 12 districts within that number of 15 units, but there was some discussion by the board and they will take the number of districts out. And it will be basically an unlimited number of districts, but will still be held to what they're calling this 15 units. The reason for that was there was concern that small rural districts, some don't even have 1,000 students in their district.
So they kind of talking about like Delmer and.
Yes, yeah.
Bellevue and Andrew and
Yeah.
some of the
Yeah.
smaller schools that.
So this is an opportunity that came out of a lot of programming planning that Christine Grader facilitated called the sequential intercept model. And this is one of the 3 areas that were identified as really being instrumental in intervening and providing services to youth, children's mental health. It was,
Did I hear you say prescription?
there is access to a nurse, a professional nurse prescriber
They were
Prescriber.
prescribed over the phone,
over the computer, over telehealth. Sure, that's going on.
without meeting, without talking, without.
Well, they're talking and they're meeting and they're seeing.
Right,
I
I
mean,
mean,
that's-
there's the,
Yeah.
The
It's
hospital
just a
does
different
like
way of doing
telehealth to
business.
decide if somebody needs to be admitted or sent home. I mean, it's
it
basically
is.
a person to person interaction. They see full body language and all that
Mhm.
type of thing, so.
Actually, the prescribers at Hillcrest, I believe there's prescribers there 3 days a week. I think 2 of those days are all virtual or over telehealth. It's been around for 10 to 15 years on a very limited basis. And until COVID was not reimbursable by most insurance companies. It's something it certainly isn't what I would prefer to be my first option. However, it is what makes these services available, especially in rural areas, not just in Iowa, but all across the country. So it certainly has been deemed as an acceptable way of providing healthcare. And it is done in all areas of healthcare, not just mental health, physical health as well.
It really took off a lot during COVID and stuff.
It did.
Cause
So
a lot
what-
of insurance companies wouldn't pay for it up until COVID and then that changed and.
And they did tell us that, Macokota High School, or the Macokota school system was very interested in it. And she said that they were going to be discussing it at last night's school board meeting,
Mhm.
because they certainly saw a need. And then Jim Irwin was talking particularly about command. She said
Mm.
they have one of the highest suicide rates in the nation in the command school system. And so he's very, very anxious to see something done there as well.
So to this extent, we hopefully will be able to take advantage of it within our county, within our region. So that would be great. Really quickly back to that insurance thing, it was mentioned later in the meeting by the director of Robert Young Mental Health Center that the ability to bill insurances for telehealth is due to sunset the end of this year. And so he was suggesting that people advocate with their elected officials to continue to allow that to be a billable activity. So, anything else you guys want to add?
I assume the administrators all get this information and.
Oh,
yeah,
that's-
yes.
Yeah, I'm sorry, that's what I was gonna say. So after it was identified as a need and this particular company had made a presentation, Christine sent emails out to all of the superintendents and all of the principals. And from that is where she gleaned some interest, particularly from the Macokota schools, from Tara, but other schools as well. And then some of the school districts were in attendance at a conference in Des Moines that a lot of schools and human service providers attend. So they had an opportunity to actually see it or hear from the program firsthand.
So the program is called what?
Classroom clinic.
Clinic.
I just wanna make sure that the local, I might make just a phone call or something, just to make sure that they're, you get 200 emails a day.
Right.
And you scroll through some of these, and I'm sorry, but you can only read for so long looking at that thing and.
And Christine is very cognizant of that. The flip side is you can only do so much to get information out, and at some point, we have to assume that the recipient has to be responsible for reading it as well, and I think that's kind of where we're at.
Yeah.
Yeah.
That isn't something we would have got though, probably though, right? We wouldn't have got.
No, I mean, this would have gone specifically to school superintendents and building principals. So, anything else about that?
I don't think so.
Does that tie into that with the move the magnet? Kind of the high school, or is that more Gary?
That, the Move the Magnet project is specifically a Gary Mativier Media thing. So we did have a presentation yesterday by Mativier Media about the 4 or 5 phases that they've implemented in how he has done marketing for our crisis system. And he mentioned in particular a project called Move the Magnet. It's a magnet, it's a crisis line magnet, and on there, it has the hashtag Move the Magnet and the bar and the QR code. So if you look at that and read into what that is, the idea is you take this magnet, you pick it up and you move it somewhere else to get more exposure for this crisis line. And it's met with a lot of cooperation, I would say. A lot of people have done that, and some of them have taken pictures and sent it off to the website or to the region.
And then we had I think he's a student at St. Ambrose. There was 2 students, college kids that were talking about
Oh,
working with that and with suicide prevention, and they're really keyed up to do and help.
there's a grassroots movement, an organization called Gray Matters,
Right.
started on the Illinois side of the Quad Cities, and Gary has brought them into some of the promotion of the region's crisis systems. And one of the football games on Sunday, I think, I saw the advertisement. It's on WHBF and KWQC, as well as social media. So if you ever catch hearing a commercial on TV that says Move the Magnet, and then it gives a couple of testimonials, if you look at that, that is one of the things that the mental health region is funding through that marketing with the TVA media.
I see that on TV.
Yeah. Mhm.
So one time there was a program, and I want to say it wasn't much over a year ago, but time flies, when there was a program like, and I don't know who sent these positive messages out, if you will, in the morning, like very early, to over Instagram or over TikTok or social media somehow to individuals. I don't know if it went right to individuals or to the school and then resent, but I think it went directly to individuals, like students. It's just a positive message in the morning for,
Yes, I remember that. That was not, I don't think, from the region. I don't know if it was from Community Partnership for the Protection of Children or CPPC or.
but they really were have
Mhm.
positive reviews about that also really working. And I didn't know if
Yeah.
that was still in place, or is that something that was not implemented or stayed?
I'll have to ask Christine about that to refresh my memory, because I do remember that, but I don't
Yeah.
remember the details.
And actually, I think there was messages that come local to our school that I heard back from, that
Uh-huh.
really, yeah.
Let's see, what else? So then we had a presentation by Dennis Duke from Robert Young Center. He's the director of that agency. They were identified and I was selected as one of 11 entities that will be providing services under what's called a Certified Community Behavioral Health Clinic, or CCBHC. And basically, It is mental health services outpatient that have to follow certain criteria. The idea is that they are available to everyone regardless of ability to pay or age or ethnicity, or there are no qualifying criteria. So they are there to provide services to the uninsured and the underinsured. And they need to provide that in what they call a holistic model, which means it not only addresses mental health concerns, but it also has some primary care components in terms of healthcare, physical healthcare. It involves substance use. They have to provide 9 different types of services. They applied and were selected to be the CCBHC for our 5-county region. Exactly how this will look and how it will move or become available all the way to Jackson County is yet to be seen. They just were awarded that, I think, within the last month or so. It is identified at the federal level as a program that the federal government wants to endorse. Like I said, there's 11 agencies that were awarded this designation. There are also several other agencies doing the similar service in Iowa under a different funding stream. So there is a definite benefit for them for their catchment area to be the 5 counties of the region. So I'm saving the best for last. So all of this talk and all of this discussion about regions, you might have heard, we certainly are all aware that there's a lot of changes being made at the state level. Reorganization in government, downsizing numbers of entities, districts, regions, whatever. As Jack and I sit here today, and then as a part of the Eastern Iowa MHDS region, that entity will cease to exist as of June 30th of 2025. As a part of the state's reorganization. The governor touched on this in her state of the speech, her address. There's 13 mental health regions and there's 19 entities that provide services to individuals with a substance use disorder. The model that they're following is taking those 32 entities and establishing 7 what they call behavioral health districts in the state of Iowa. The map is out for the proposed 7 districts, and to our advantage, our mental health region, as we know it in terms of membership, will remain the same. We will be one of those 7 behavioral health districts. They're not dividing our region. They're not bringing more counties into our entity.
We're the only one that wasn't changed.
Right.
That was a PowerPoint that was sent out, I think.
Yeah.
Yeah, did you see that?
And
Okay,
I
yeah.
was amazed that some of these had like 20 counties in it. We're still at 5 or 6 or whatever it was.
We're 5.
Right, and we're only a population of 300,000. So some of these others, obviously, Polk County, if you remember, was its own mental health region, and now they are.
Now it's merged with
Are
it.
they 5 or 6, I think? So they added more to Polk County. We do know something, or Lori has a good sense on some of the changes that might happen. One is obviously the governance of this kind of an entity. The governing board, as we know it and attended it yesterday, will not exist after June of 2025. It will be replaced by what we understand well, I don't even know if they'll call it a governing board because I don't know that it's been
An advisory
an
board.
advisory board. It's only gonna be advisory in capacity. So it's
And
not,
it will
That's what
include,
they ended up doing with the 7th district.
was it the same thing?
I
Yeah,
they'll be doing, making appointments, and they may be elected officials, they may be, it won't be like it is now.
Lori was saying,
It could be a mayor, it could be somebody from law enforcement, which we have now,
yeah,
and schools. It's just going to be totally different than what we currently have. Lori will not be the CEO for the region. We don't know how that's all gonna work out, but it's certainly gonna be different than it is now. And we'll see how that. Somebody said they were kind of fashioning it after Colorado,
oh,
and they've been fashioning everything else after Texas, but Colorado got in there now. But it'll be a whole, it'll be a whole change for everybody.
Yesterday Lori was talking about it being a 9-person board, I think, 3 people. Elected officials, 3 people that are providers, and 3 people that are individuals who either receive services or a relative of someone who receives services. So in addition to the 7 districts, each district will have an entity that will be responsible for all the money, an ASO or an administrative services organization. There will be a request for proposal that will be put out. Lori was thinking it would come out in April. However, originally we were all told it was gonna come out the first week in the legislative session. Now we're, into the second week. And the bill isn't written or it hasn't been proposed yet. So the delay in getting the bill out potentially could delay the timeline for putting out the RFP for this, what they call ASO. That entity is going to be responsible for managing all of the money and doing all of the contracting with the agencies. And so any money that has been returned to Iowa that hasn't been spent, like in our case, and they put it in what they call the incentive fund. All the funds that currently are coming to the regions will go in this fund. There are some community block grant dollars that come into Iowa that will all go in this fund. I think even early childhood and DCAT will go into this fund. And this ASO organization from each region will be the responsible party to do the contracting, to do the quality assurance, to send in the data to the state. Anyone can apply, well, not anyone can apply, those that are eligible to apply to become this ASO, could be a government entity, it could be an individual. What it can't be is a provider who benefits financially from providing services within that region. So, more details to come. We're hoping that with the release of the bill, that will give us a better idea of actually what they see the framework to be. So we can figure out how to move forward. One of the internal organization or reorganizations that's happened is services and funding for individuals who are receiving that through intellectual disability diagnosis or brain injury will no longer be a part of this behavioral health unit. This behavioral health district is only going to be comprised of the mental health aspect, the substance use disorder, the tobacco and gambling dollars. Those are the other dollars that will be in that pool for the ASO to manage. So it will be more streamlined specifically to substance use and mental health. So I don't know, what else, Nan and Jack, do you guys?
I think you covered most of what I had as notes.
Any questions about that?
Well, like you're obviously there's gonna be change, I think, because if you will, society changes, people change. So there's a lot more, I would say, need for it than there was 20 years ago, I suppose, when it was set up. So hopefully, my hope is that it changes for the better, I guess that's the case, but.
Yeah, there certainly are some good aspects of it. I mean, the conversation about mental health and substance use, not collaborating and talking together, has been around. Jack probably remembers that when you were on the Mental Health Center Board of Directors. And the fact that substance use has always been under the Department of Health and mental health's been under the Department of Human Services, that was always seen as incongruent to helping people. The thing, I guess, that is most concerning to me is obviously when you go down to 7 behavioral health districts, and a board, even though there's representation from the 5 counties within that entity, we're getting further and further away from any local input into decision making. And that's to me the concern going this direction, this extreme direction.
Because once it's in operation that way, the boards of supervisors, and one of the things I did ask at the meeting was, will there still be a local coordinator of services like Lynn, and every county has one? And Lori said she thought maybe, but she didn't know.
the role of this position that we have in our 5 counties will certainly, the responsibilities will change.
It almost seems like what they're doing with mental health is what they're doing with Iowa workforce. Kind of going to the regionals that we no longer have a local somebody, you might have a computer available once a week kind of thing. And now out west and Iowa, most of those counties don't even participate.
Oh, really?
They opted
Yeah.
out because of funding things and stuff,
Mhm.
so I wonder if it seems like it's going in that direction.
Well, I know one of the regions is, I mean, the southeast region is really large. And they said the reason that they did that is because they didn't have access to some of the services that they needed. And so by increasing that, but you still have, one of the things we always talk about is the hardest thing
To get them
in
there.
most cases is transportation. And depending on where that provider of that service is, decides whether they can actually get to them or not. RTA takes them back and forth to Iowa City and other places, but it's not always at the most convenient time. And so, I have some real concerns about the change. I talked about it at the HHS meeting because they brought it to us at our meeting this month. And I asked, there's a Marisa, and I can't remember, there's 2 Marisas that are overseeing this. And I said, what you're talking about is what our region is currently doing, because one of the biggest things was crisis services. That a lot of regions didn't have anything on children's crisis. We do. We have a whole array of things for children's services. And the one Marisa says, yes, we know what you have. And yes, you're trying to do things right. And you're trying to get things that other regions aren't doing. So I said to Lynn yesterday, I think they're using our region as an example to create this. But when you look at the size of some of those regions, it frightens me that people are going to have the kind of access that they need to those services.
Yeah, it's true.
And not only are they there, but can you get in then at the
Yeah.
point that you need because of the
Mhm.
size,
Mhm.
It's amazing that you say that. So as Lester Holt was on last night and they showed this place in Maryland, which used to be it was
Oh.
500 acres.
Mhm.
And they had building upon building. If it was at one time, it was called either the poor farm or the institution or a hospital or whatever it was called. Now they're talking about actually remodeling this whole place and redoing it and a park and trails and whatnot for people to come and get help. Now, to me, that's an institution again, which we tried to get rid of 5 years ago,
Well, we did. 2 of them are closed in Iowa.
Oh, yeah, happened.
Yeah. And
Almost 10 years.
we have lawsuits.
Yeah.
2 lawsuits that are against the state, so we'll see how those all pan out also.
Mhm.
Yeah, well, it's never ending, I suppose, and again, we'll stay tuned as far as what's next. I mean, I did read
Well, Lori told us we were all supposed to read the law when it got here, and I said to Lynn, I says, would you please make me a copy? I don't want to have to read it on my iPad.
She's gonna summarize it and send it out to the board so that they get the high points of it and.
And
Have
make
an
sure you get a
understanding.
copy.
you probably still
too.
get the legislative updates though, for as far as updates go, I mean, as far as weekly updates and stuff. Don't you, Jack? You get them, yeah?
Some,
Yeah.
not a lot, but some.
Yeah, so stay tuned. I don't know. I mean, there will be a lot of conversations and redefining of roles within.
I mean, even this AEA thing goes, everybody's wild about it, but let's see what it all entails, If the money is going to go through the school itself and they decide, they can still decide, to me, what I read about it is they can still decide to use AEA or and work it themselves.
And
to
another
their own
thing,
system.
what's his name? On AEA.
Oh, Aaron.
Aaron Rome is on on our board, and he has some real concerns about what they're talking about and planning to do,
Sure, yeah.
so.
Well, and Lori was kind of talking out loud yesterday at the meeting in terms of that's potentially what delayed some of this mental health bill coming out, because that AEA thing took on a lot of conversation. And I think it maybe derailed the fast track that was on at this point in time because of some advocacy.
Yeah, they had a lot
For it or
of,
against it, you know,
a lot
so.
of people that were complaining and saying that, you know, you can't do this. you
Well,
can't
there's a
do
lot of
that.
discussion to be had yet.
Yeah, yes, there is.
Yeah, and I don't know initially if it was anticipated that there would need to be that much discussion and it would take that much time to get something.
Yeah.
Passed, so. But yeah, we'll see.
No,
Yeah.
Train left the station.
we've been saying that for as long as I've been here.
Oh, amen.
Yeah,
As long as you've been here, Jack, they've been saying the same thing.
Yes.
Well, we appreciate it very much and
yep. We'll
get
keep you
home
posted.
safe.
Yeah,
Slide home if you will. Be
Well,
careful there,
it's
man. You're
not
almost
right
close to
now,
bumping
so-
your noodle.
Take care.
That's the way. we
Yeah,
do it.
thanks.
Stay
Thank you.
upright.
Yeah, stay up there, yeah. Okay, is there any other business before the board this morning?
Yeah.
We're just about right on time. We have a scheduled,
Motion adjourned.
Second.
have a motion and a second to adjourn. All those in favor say aye.
All right.
Aye. Opposed? Motion carried, meeting adjourned. Thank you.